Yes, sir.
So, good evening, everyone, to this marathon of 2 hours in which we try to learn the basic outline. See, it is not possible to teach you all 26 medicines in depth, but the reason of conducting this webinar to just brush up with the basics and what is the most important criteria for this all 26 remedies so that you will be easily so that you can easily use in your practice and you don't miss out on a daily basis. When you see this type of cases, you can actually find them very easily to identify, especially with their constitutions first. So the reason I brought up this because this is the most neglected topic to be discussed always, and it's all about giving theraps and specifics for each and every cases. The only motto here is to see what is the constitutional remedy for this patient. No wonder what disease he is suffering from. So I'll start with the first remedy, that is outline of the constitutional remedies. Like today we are going to speak about the physical type of the build, the psychological features of the remedy. So it just I'm giving a glimpse, an idea what we're gonna learn today. We're gonna learn today the outline of main symptoms or physique or their modalities or their aggravation, amelioration. These all things has to be discussed today. And even the personality patterns along with their diseases, everything will be discussed remedy by remedy. Suppose you have to see how sepia is, how sulfur is, how natramure is. So we'll discuss this. The first remedy is argentum nitricum. Argentum nitricum. So argentum nitricum, the most anxious remedy of the Materia Medica. How these people look? Anxious, thin people who look prematurely aged. And what is the prominent feature? Apprehension. Apprehension. They keep on anticipate what will happen, kya hoga. And even if they want to catch a train at 1 p.m., they'll go at 12 p.m. and sit 1 hour before. Why? Because of this apprehension. And they are extremely hot patients. They have intolerance of heat, but and craving of fresh air. That's why urgent nitricum shares relationship with pulsatilla. Okay, because of the fresh air. Now coming to the point of urgent nitricum apprehension is can be it's a same like dysentery co. I don't know how many people are aware of this dysentery co, but when you're treating a case of urgent nitricum and you are not getting any good results, and that he's a typical patient of urgent nitricum, you can think of dysentery co just to enhance your Materia Medica knowledge. Dysentery co is a similar drug with urgent nitricum and along with arsenic. Now, how do you confirm urgent nitricum? Urgent nitricum, you have to see the fear in his eyes when you ask questions. Like, suppose you'll ask his any phobias or anything, and when he expresses is any phobia, or dark or tunnel or claustrophobic, anything, you look into his eyes and see the weightage of the symptoms can be calculated, that how much prominent is this symptom has to be considered. That's where when the suppose एक patient से पूछोगे कि चूहा से कितना डर लगता है ना, you give an example how much what fear you have from rats, and as soon as they say rats, I'm scared of it, this expression, this is invaluable expression, this is called weightage of symptom. You have to understand and you have to give importance during the case taking, how they express their own symptoms. So coming up next, physical generals. The modalities, like I said, urgent nitricum are better by open air and worse by any mental exertion is worse. Suppose he wants to travel tomorrow for Bombay or tomorrow for Nagpur. He'll keep on anticipating, how will I go? Will I get this or will I not? Keep on thinking, keep on wondering what he can do or how he will reach. This anticipation is so much. This triggers his diarrhea, triggers his urination, involuntary urination, urge, trigger his nervousness, triggers his palpitation. These all things come down just because of his apprehension. And they are the sugar eaters in the kitchen. They just love sugar. They cannot live without sugar. Along with that, if you find in Materia Medica, sweet and salt, sugar and salt, the combination, sweet and salt, that's what, sweet and salt combination, this is very characteristic of urgent nitricum. Even the people who like this combination of sugar and salt, that is the best combo for urgent nitricum. And they love cheese. Love cheese. Another remedy you can think of love cheese, that is Cistus canadensis. And now another remedy which hates fat. Anyone? If I say hate fat and still they eat, then everyone can say the remedy, right?
Pulsatilla.
Yes. And tell me a remedy who loves butter.
The nitric acid.
Yes, very good. Likes cold drinks. Urgent nitricum loves cold drinks. Now, coming to the GI tract, their flatulent dyspepsia, their diarrhea, their dyspeptic condition, bloating, abdomen bloating, lot of rumbling, these all sounds of urgent nitricum, and along with that urge to stool. Now, speak about headache, they are better by tight bandage. Trembling, they have always sense of imbalance when walking. That's why urgent nitricum is also one of the remedy for diabetic neuritis, diabetic neuropathy, you can say. Even in the locomotor ataxia, these all urgent nitricum is very marked. The fears can reflect in exam, fear of failures in exam, fear of flying, fear of crowded places they don't like to visit. And it can also accompany all the fears which urgent nitricum has. It has been accompanied with lot of palpitations and along with that accompanied by sweat. So you need to see. Now they have typical sensation in the throat, that is splinter-like, that is pricking sensation in the throat. And the eye strain, the straining of the eye, the overexertion of the eye, even sand-like sensation in the eyes, pulsatilla-like discharge in the eyes. These all things are covered by urgent nitricum. Next, the most important remedy, arsenic trioxide, arsenic album. These individuals are very thin, very sensitive, and very fastidious. These are the people who comes to your door in the clinic, and once you have explained them everything, they'll go again. They will knock the door and ask, "Oh, doctor, I forgot this thing has to be asked. Oh, what to do? Okay. Then again they'll go. Then again they will come, knock. Oh, I'm sorry, doctor. I'm really disturbing you, but I just want to know this. This pills has to be taken like this. This medicine has to be taken like that. Okay. Yes. Then he will go. This constant anxiety reciprocates his anxiety about his health. And this is the objective expression you should see when you treat a case. How is he behaving? If you compare this same with nitric acid is extremely discontented person. Usko jitna bhi do utna kam hai. Suppose he has a problem with albuminuria, okay, and you're treating the case. His albumin is nil, no problem at all. The pathological reports are normal, everything is normal, and you'll say, "आप तो बहुत अच्छे, सब कुछ ठीक हो गया. You are all well. What to do?"
तुमच्या सख्या
No,
बहिणीला
sir.
म्हणायचं काम आहे की नाही आहे?
मला आम्ही हे चिवत्या फुकटच मला करू
Sir, can you please mute each of us as host?
Oof. Wait. It's really annoying. So, yes. So I was teaching about the comparison of arsenic and nitric acid. It is very, very important. Even I've shared this in Instagram also, the anxiety of this arsenic and nitric acid. Nitric acid are the people, suppose, like I explained you, he's suffering from aluminaria, he's treated with nitric acid with his remedy, and everything is fine. Pathological reports are also normal now. And still, he'll complain you, sir, अभी भी ठीक नहीं लग रहा है. नहीं, I'm telling everything report is fine. Everything is fine. No, sir, I'm still not feeling well. This discontented, the word is discontented, is very, very prominent of nitric acid. They cannot be satisfied. And nitric acid are the people who keep on grudge for years. They cannot easily forgive to anyone. If you ask them, they'll say, no, I cannot forgive them. There's a rubric also, unmoved by apology. Unmoved by apology. You can see. So coming back to arsenic are very, very intelligent and fastidious and quick in action. They want everything quick, results quick, the food quick, everything. They are extremely hurried person. Not hurried, then there's another remedy, histaminum. Histaminum is the most hurried remedy in the Materia Medica. You cannot find anywhere. He's so much hurried. If he wants to catch a bus in a bus stop, he will go to another bus stop. He knows, suppose he is waiting in a bus stop. Okay. He knows that this bus might have come to another bus stop. What he will do is, out of hurriedness, he will go to that bus stop and try to catch the bus from there. This much hurriedness is in histaminum. अगर हड़बड़ाने का बात किए तो. So arsenic is also hurried and fastidious, and also both side, he is very much prostrated as well, out of proportion, don't have energy to do work. And at that time, what he demands? Someone to come by. Hey, come here, stay with me in the house also. Hey, come here, be with me. So this desire company when he's sick, and yet he don't trust them. Still he wants them only. That mistrustness with arsenic. And all the pains are burning. Every pain is burning. They'll complain like whole chest is burning, whole mouth is burning. And they're extremely chilly people, and predominantly that is right-sided remedy. Now, they are better by heat. All the complaints are better by heat. Now, let me tell you, they have a desire to drink cold water. They have insatiable burning thirst. Insatiable burning thirst. Burning thirst. Now, प्यास जो बुझे नहीं, इतनी प्यास, और वो प्यास में क्या चाहिए? They want cold water to drink. They want cold water, but they don't drink it because it aggravates their condition. And as soon as they drink warm water, they feel better. And how the arsenic will drink the water? In frequent sips. Like suppose and 2% go to interview. One is lycopodium, one is arsenic. Okay? Lycopodium will take few sips and keep the glass. Like in a whole round of 1 or 2 hours interview, he will take only 1 to 2 sips. And arsenic will actually have more than 8 to 10 glasses in this 2 hours. That is a difference between the anxiety and the thirst of lycopodium and arsenic. I hope it is very clear. Okay. So everything is not possible, but I'm giving a glimpse, a gist, so that it will be a very easy. Because what is happening here in Materia Medica, हमको डिफरेंशिएशन करने में बहुत दिक्कत होता है. ये भी लग रहा है, 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 कैसे करें? These subtle small differences, which I'm keep on posting everywhere, these subtle differences are actually made someone to remember Materia Medica very, very easily. And this is the only way you can remember all the drugs. So arsenic likes fat, and aggravation period is 1 to 3 p.m. and 1 to 3 a.m. both. Arsenic are the first remedy when we think of acute colds, where they have excoriating discharge, fluent watery discharge, excoriating maybe, and also causing a sore upper lip. Diarrhea, vomiting, add together. Another remedy is compared with another two remedies which can think of, that is camphor and vrat, trio of diarrhea. But what is the difference? Camphor mein there is lot of coldness with diarrhea, and vrat mein there is lot of cold sweat on the head. And in camphor it will be extremely cold. When you touch their extremities, ekdam thanda, baraf jaise haath paw pura coldness ho gaya. We had used in COVID also. Amazing. Camphor, arsenic, bryonia, many. No same drug was used for everyone. Everyone had a different picture who were the patients of COVID. So don't be under impression that we gave arsenic to 10,000 patients and we got everything. No, this was not the scenario. Everybody had a different symptoms. Somebody has a fear that whether he'll die or he will save or not. Somebody having loose motion, somebody having UTIs. Everybody has a different picture. So asthma, arsenic asthma, and let me tell you, arsenic asthma is like as if jaan hi nikal jayegi. That's so much of anxiety in the chest and anxiety during breathing. Suppose you are treating a case like this, and it is the first remedy, you think of arsenic only due to this breathlessness. Suppose it fails, what to do? Think of Sensory's Coton Tricks. If you open Boric, you will find the first few lines of Sensory's Coton Tricks. How beautifully it has written: in dyspnea and restlessness, when arsenic fails, use Sensory's, and definitely will help that patient, and his breathing will also get normal in few minutes. And then also after 10 to 20 minutes, still Sensory's is failing, the last remedy, that is lachesis. So remember these three remedies: arsenic, Sensory's, and lachesis. So acute heart failure at early stage, also arsenic. Next, calcarea carb. Calcarea carb is the biggest polycrest, have so many things inside, made up of a middle layer of oyster shell. This is calcarea carb, fair, flat, flabby. And these are the flabby person, where they will sweat head and also chest. They are very, very sluggish. They are depressed easily. They are very, very forgetful, and they are extremely chilly patients. Yet they cannot bear cold, but they have all the troubles from chills. These patients are extremely flabby, chubby, and tell me something beyond calcarea carb, what remedy you can think? Who's extremely fatty and chubby? I have already.
Medorinum.
Yes.
Medorinum.
No, another. There is a word called which constitution?
Corpulent constitution.
Yes, corpulent.
Graphitis.
Graphitis and calcarea carb is the same. Only the constipation part is the difference. Calcarea carb is very upset when during constipation, and graphitis is very happy when he's constipated. Corpulent constitution. So
The
find the drugs.
colocynth.
No colocynth. Strophanthus is one of the remedy. Strophanthus is one of the remedy for corpulent constitution. That is beyond calcarea carb. Extremely chubbiness. All time. So now modalities of calcarea carb. Dislike open air, worse for cold. Dislike milks, they love eggs. Hard boiled, fried, any form, they love eggs. Now, calcarea carb is indicated in enlarged glands, delayed nutrition, delayed dentation, all type of exostosis, heel spurs, bony spurs, spinal spurs, rickets, depression, constipation. So, sorry, they feel better by constipated, and graphitis feels worse when constipated. Sorry. So, calcarea carb, they feel extremely better when they're constipated. It doesn't bother at all. And when they come to the patient or as a patient, they never bother to say you that they are constipated because it doesn't affect them. So they don't express about it. But graphitis is extremely annoyed due to this constipation. And gallstones. Calcarea carb is excellent for gallstones. Now, I'll tell you a very important thing. Suppose you're giving like calcarea carb and it's not helping. And the modalities of pain are like Rustox. Think of Rustox. I'll tell you where. The cases of actually RA, OA, because who suffer from OA? Who are obese, more healthy, they have deficient in vitamin D. So these people actually suffer from OA, even osteoporosis. So these people, if their constitution indicates like calcarea carb, you can give Rustox as well. If calcarea carb not responding. Fourth, causticum. Causticum, potassium hydrate. Causticum is a patient broken down constitution, anxious, and who doesn't like mental exertion at all. These have the favorite weather, that is rainy weather. They love rainy weathers. They have a different smile when it rains. Highly sensitive to injustice. They cannot tolerate if somebody is pelting stones to the dogs, on the street dogs. They'll feel the pain and they'll say, "Kyun maar raha usko? Why you're hitting them? Why you're hitting them?" And they will even say this, "Agar tere ko marunga वैसे अच्छा लगेगा." That is the same word they used to say. Would you feel the same? So this is the thing what causticum has, and they are predominantly right-sided remedies. They cannot tolerate sweet in any form. They are aversion to sweets. They love damp weather, warm weather, and they are extremely chilly. So they have aggravation from cold, dry winds, and aversion to coffee. They cannot tolerate coffee. Now, in Bell's palsy, Horner syndrome, paralysis of the single verbs, even in trigeminal neuralgia, where there is a right-sided trigeminal neuralgia, causticum, hoarseness in the morning, they'll feel they cannot speak, involuntary urination, frequent urge of urination. All conditions are affected in the jaw and the mouth, and even the pain referred gets ear. They get referred pain to the ear as well. Now, rheumatism, causticum is a very helpful drug if indicated. I'm not telling it is specific for arthritis, but if it is indicated, causticum has a deep action in arthritis. Very deep action. The contracture of tendons, the stiff neck due to the cold exposure, even the face warts. Face warts, actually everyone thinks tuja, but causticum is also a leading symptoms for face warts. And along with that, like I told you, incontinence of urine, stress incontinence especially, the first drug that will be helpful, that is causticum. And due to anticipation, there are many, urgent nitricum, gelsemium, and this can be differentiated by the cause. Now, very important symptoms. How do you recognize the stammering of causticum? Causticum people stammer accompanied by they'll make faces, they'll make grimaces. It's called as grimaces. Making faces is called grimaces. So stammering accompanied by grimacing, think of causticum. Next, graphitis. Graphitis, black lead, carbon. Graphitis are the people. Graphitis are the coarse. These are the people are coarse featured with tendency to obesity. This is the same as calcarea carb. But the difference is their skin is more rough and dry, even to the verge of cracking, like I showed the picture here. And they are very, very sluggish, indecisive, timid, and easily startled. थोड़ा सा भी कुछ हो, चमक जा. That is startled. Depression is very common state of mind, and constipation always accompanies with all of the symptoms of graphitis. साथ साथ चलता है सारे complaints के साथ. You will see a constipation feature is add on. Now they sometimes complain of odd sensation as if they मतलब मुंह के सामने मकड़ा का जाली जैसा लगता है. All the time there is cobweb sensation in the face. This is very prominent of graphitis. Very, very prominent. They are fat, chilly like calcarea calf, and have a tendency of constipation. Even the oozing of the skin, the sticky discharge, thick itching, leukorrhea with itching, same as creosote. Graphitis also there. And graphitis hates sweet foods. Graphitis aversion fish, aversion seafood. What they like to lie down in dark. This is graphitis. When you can think of graphitis in the cases where there are honey crust like eruptions and sticky. Tell me another remedy, quick.
Antim crude.
Meserium.
Meserium.
Have you anyone read Vinca Minor?
Vinca minor.
Yes.
Yes. Vinca Minor is very, 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 very related with this type of eruptions as well. So, and cracks and fissures behind the ears. I was struggling with a case which helped me. I'll tell you the remedies oleander. So read oleander also. So eczema, rashes, sticky eruptions with sticky secretions like honey behind the ear or at the margin of the mucous membrane here, and they can be crusty eruptions also. Now, very important symptom, we should all know that graphitis is very, very indicated in duodenal ulcers. Duodenal ulcer, DUs. Why? They have that typical symptom like anacardium and calibi, and graphitis has that. As soon as they eat, their pain ameliorates. So in DUs, duodenal ulcers, anacardium also pain better, even petroleum also, graphitis and calibi. Digestive symptoms, skin complaints, they keep on alternating. Skin symptoms and digestive symptoms. If skin symptoms are better, digestive symptom will get worse. And if digestion is good, skin will get worse. And even the glands are enlarged. Now the nose bleeds followed by flushes. Next, hypersulfur. Hypersulfur is calcium sulfide, the interior part of the oyster shells burned with flowers of sulfur. Hypersulf. These are the remedy who in anger feels to set things fire. आग है इस remedy में. They are highly irritable, oversensitive people. Highly oversensitive, I'll tell you example. Suppose a patient has a complaint and it comes you with extreme excruciating pain, or it might be any pain, even gallbladder pain or any colic, anything, and they cannot even they cannot even tolerate a cloth, pressure of a cloth or touch of a cloth, even touch of a cloth, and they're extremely sensitive. Then you can think of hypersulfur. They are so touchy. So understand the meaning of touchy here. So, and they're extremely chilly people. Modalities, they are better by warmth, wet weather, worse for touch, like I explained you. Worse for uncovering, they like to cover themselves. Worse for cold air, they cannot tolerate cold air. And food, they like pickles, sour food, like Antim crude. Now, all the suppurative stages, we all know hypersulf is very, very indicated, as well as the ulcers, the tonsillitis, the croup, especially in croup, we know they follow a cycle, aconite, hypersulf, spongia. Like Hahnemann has treated croup like this in one of these cases. Morning he gave aconite, no response, slight amelioration, then he treated with hypersulf, then he got cured by spongia. I think we all know this. But hypersulf is a wonder drug, even with a throat pain, suppuration, suppurative tonsillitis. It is highly indicated in this kind of conditions. And they have what? Splinter-like sensation in the throat. and the pain can radiate to ears. Now, the most important remedy, that is ignitia. And I think it's an everyday remedy now these days. Every day, everyone needs ignitia's help because they are so struggling with the situation here, especially after COVID. Because किसी ने क्या खोया, किसने क्या चला गया, they keep on wondering about it. These emotional aspects are the fundamental importance. These nervous and neurotic patients, their mental and physical conditions change rapidly, and they often present a contradictory. When you ask them, they'll just refuse. That is a contraindication of ignitia. When you ask something, they suddenly say no. They contradict your own statement. So that is the contradiction of ignitia. And how to recognize these people? When you take the interview or case taking, they keep on, when you speak to them, this constant sighing. But this ignitia is not the only one for constant sighing. Calcarea phos, acid phos is also very, very marked for sighing. And these all three remedies have ailments from love disappointment. So you have to differentiate. And ignitia people will always hide their grief, which is called as undemonstrated grief. They do not want to express. If they express, they will sob and sob. No wonder how many times you will console them, they will not get quiet. Remember this. एक बार ज्वाला फटा तो वो कंटिन्यूस रोते रहेंगे. They'll keep on sobbing. No wonder जितना भी console कर लो. Because वो एक बार निकल जाए तो वो ignitia का है. Because many of the times you will take history, you will find that this child has not cried, or this person has not cried in his father's funeral, or this girl has not cried on mother's funeral. So these all things बाहर आता है. एक गो में कुछ नहीं मिलता. Maybe you need 2 counselings or 3 counselings then to get the picture of it. It is not easy that in one shot every case will be solved. Never. Don't be under any impression. Biggest of biggest stalwarts have not been doing it. Physical generals of ignitia, the marked symptoms, ignitia people never use perfume. They never, because they cannot tolerate the smell only. पूछो परफ्यूम लगाते हो? नहीं. क्यों? अच्छा नहीं लगता. Cigarette smell, they cannot tolerate. That is a very marked. Strong odors, क्यों? हेडेक हो जाता है. कुछ भी स्ट्रॉन्ग आता है ना डॉक्टर साहब, मेरे को बहुत हेडेक होता है. बहुत. Same as sancan. Sanguinaria canadiensis. Odors से problem है. Better by heat. Now ignitia likes heat. Worse by grief, worse for worry. And the marked symptom, one more, is ignitia. They cannot eat fruits. They cannot eat fruits. Fruits खाएंगे ही नहीं, कितना भी दे दो. And what they eat, that is sour food. Now, when it is indicated more, all ailments of disappointment, of grief. दो लोग झगड़ा कर रहे, सामने वाला बेहोश हो गया. That is hysterical. That is ignition. It got so much affected that she got fainted. That is hysteria actually. Throat. Sensation of lump in the throat. पूरा दुख जब गले में आके फंस जाता है ना, तो समझ नहीं आता. तो that lump sensation comes all the time. क्योंकि वो तो रो नहीं पाता ignitia. तो all grief can pent up here and they keep on feeling here. आंख भर जाता है डॉक्टर साहब, लेकिन हम रो नहीं पाते. That is the main feeling of ignitia. They cannot cry. No wonder they are so much sad, but they cannot cry. So same thing is reflected in the throat symptoms as well. In the esophagus, they feel like lump-like sensation, and they can only swallow solids, not liquids. They can swallow solids, and they are worse by coffee. And the headache is very typical, as if someone screwing the nail through the head, as nail has been driven through the side of the head. That is a symptom of ignitia. Now, Kalibai. Kalibai is a most important drug of current situation as well. I think all of my students have been witnessing it. Kalibai is a current scenario remedy, very, very marked. That is called, summer cough, Kalibai, winter cough, and Timtat. So, Kalibai. Kalibai is suited to the fat, chubby, sluggish patients who present with what kind of stringy, ropey. In the cough, they expectorate, if you ask them whether it was easy to detach in the basin, it was difficult. So it's sticky. You can find the character. It's sticky. First thing, sticky. Don't conclude the remedy. Sticky. Because coccus cacti में भी sticky है. तो ऐसे नहीं करने का. Find what's the character of discharge. So next, they'll complain of the pain in particular spots. Doctor Saab, this part is only paining. This spot, pain in spot. Pain in spots are so small that they can point out with a finger. एक उंगली में बता सकते हैं यही जगह मेरा पेन हो रहा है. This so you try to understand this.
मी पण लेकराचा बाप आहो. मी मला लहान जरी पाहिलं असेल तसं ते चालत नाही.
So this pain in small spot by a finger you can point out. These people can point out only this part is paining. This is so small spot of pain. So try to understand this. What is the exact meaning of small spot? Now, alternative pains like shifting pains, even alternative symptoms. Pain might migrate and alternate with other symptoms like stomach pain along with the katra. These alternating of symptoms. Shifting rheumatism like pulsatilla, Kalibai is very, very marked and they are thermally chilly. Now, Kalibai has a strong craving for what? Beer. And you know what happens after beer? They sit for diarrhea. They have all aggravation after beers. Worse, diarrhea is worse after beer. That is Kalibai. And they love beers. Along with that, the midnight aggravation, 2 a.m., 3 a.m., and they love starch and potatoes. And they are better by heat. Remember, Kalibai, heat. And Kalibai, pulsatilla, both have, along with laccan, both have alternating and shifting rheumatism. These all three remedies has this. Now, talking about the chronic katara, what happens in Kalibai, all the discharge is very stringy and sticky. Stringy discharge. Also, दूसरा नाम में क्या बोलते हैं? Viscid. रेपर्टरी के टर्म. थर्ड टर्म में बोलोगे क्या? रोपी, रस्सी जैसा. So these all different words has been given by different users. Now coming to the stomach pain, like I told you, even in peptic ulcers, Kalibai is used. But let me tell you, Kalibai, everything is every ulcers in the body. Kalibai has a punched out ulcers. Even Kalibai I have not mentioned here. So listen to me. Kalibai is a wonderful drug for corneal ulceration where the cornea is perforated and they are not growing or they are not spreading towards laterally. So Kalibai is a very good drug for all punched out ulcers. No wonder anywhere in the body. Punched out. So mark my point, punched out ulcers. Now next, like I told you, the pain wanders from one place to another, shifting rheumatism. Next, Kalibai. Yes, sorry, Kalika, potassium carbonate. Kalika is the patient who is full of anxiety, full of fears. What will happen to my children? What will happen to my health? Anxiety about his children, anxiety about his health, anxiety about his family. You find all Kalika. Now, what happened here is they have a lot of irritability along with this weakness. And they have this feeling of failure. Fear of failure, feeling of failure together with distress. And along with that, what they have? Forgetfulness. And physically, the Kalika is flabby, sallow complexion, that is pale. And what, feet are flat. Kalika people feet flat. And the impression is one of weakness along with depression. And thermally chilly. Right-sided remedy. Also left-sided, both the sides the remedies are there, Kalika. Now, Kalika, all pains are better by motion like Rustox. That's why Rustox Kalika complementary. Also CPR, better by motion. Worse by touch, easily startled, worse after coition. The pain aggravates, even the back pain gets aggravates after the coition. Worse lying on left side or on the painful side. Now, tell me a remedy which share a same relationship with Kalika, but they are lying on affected side ML.
Brian.
No. Tell me a remedy. Suppose you gave for
Okay.
abdomen pain and it fails. Only this remedies can cure.
Holocenth.
Yes. Colosenth. Because Colosenth, like the
Colosenth.
affected part is ML and Kali Carb is opposite to it. Yet, if there is abdominal pain which is better by bending forward and you gave Colosenth, still it is persisting. Give Kali Carb, it will cure the case. So foods like sweet, starchy, acid, and sour drinks. Now, the most typical symptom, like all the asthma patients, usually what they say, they feel better by bending forward. See, this is quite common symptom with all the asthmas. You need to figure out at what percent he is getting relieved. Very important symptom, because 90% of asthma cases, when you ask them to bend forward, they say this. This doesn't define that every patient is Kali Carb and they'll feel better. So you see the affinity and their the authenticity of this symptom in this case. Worse for pressure, even the coughs, pneumonia, right-sided pneumonia, dry cough, and better the dry cough is better by leaning forward. Tell me, cough, if we stretch the throat like this, he coughs.
Acid phos.
No, acid phos is a drug when he cannot bend his neck. He has choking sensation. I'm asking which is a remedy who coughs when he stretches the throat. Lyco.
Fainting touch.
Lycopodium. Lycopodium is
So
a
why
remedy.
he does that?
Because it gets constant itching, the scratchiness in the throat. And lycopodium coughs are more in pinning boys. In a word there is pinning. Patla dubla sukda ladka. Like cough in emaciated boys, you find lycopodium. Cough in dry pinning boys, you'll find lycopodium. Everywhere you'll find lycopodium. Patla dubla sukda chronic cough se suffer karta hai. Think of lyco. Headache is bitemporal. Backache after pregnancy. So puerperal, after puerperal delivery, that is after puerperal condition, you can find a lot of back pains. You think of Kali Carb, even before menses, and lot of flatulence, bloating, distension. This is all Kali Carb, and they are worse by ice cold water. Now next, Kali Phos. Main remedy for what?
Weakness, debility.
And one another like another most important, I think everyone uses
Gosh.
for sleeplessness. Sleeplessness of the business persons, you see, na? Over
Yes.
business persons. So let me tell you something good. These are the people with a very, very dark hair and exhausted neurotic persons. They're typically exhaust my brain fag, like picric acid. And the very important differentiation of their physical appearance, and let me tell you, all the Kali salts like Kali Carb, Kali Bai are fat except Kali Phos because they are like phosphorus. And these patients hate to be alone, yet they are very shy and find they are worse for talking to people. They are very shy. They cannot, मतलब लोग चाहिए भी और मेरे को प्रॉब्लम भी, मैं interact भी नहीं करूंगी. That is the problem with Kali Phos. They cannot open up, yet they need someone to stay next to it. And they feel as if they are going to break down. Chili remedies. And again, they are better by motion, better by heat. Worse for food, they don't like. Worse for worry. Worse for exertion. Worse for excitement. So it has both. Worse for exertion as well as better by motion. And what they crave, like phosphorus, they love ice cold water. And they like sweet foods. And even sour foods. When to think of Kali Phos? Headaches of overworking students. Typically overworking students who have exhausted themselves and the head is slight tender to touch. Insomnia in adolescents. All the adolescents age group, they have suffering from insomnias. Next, the most favorite remedy of many people, lechesis, surukuku. Lachesis are extremely loquacious, excitable, lot of jealousy, the sibling jealousy as well, like epismel and lachesis. They are main to sibling jealousy. Suspicion, intolerable to tolerate, tight close in the neck and along with abdomen, both the things. Lycopodium को neck से फर्क नहीं पड़ता, but abdomen से पड़ता है. Lachesis को neck and abdomen दोनों से पड़ता है. Another marked feature is blue or purple color of any skin disorder, ecchymosis, purpura, thermal, hot, and they are more left-sided. Now, they are mostly alcoholics. They like alcohol a lot. They want lavish life, sex, drinks, sleep in the morning, not in the night. And what they are after sleep? Worse. Better by onset of discharges like nosebleed, menstruation, and worse for pressure in everywhere. But this is contradictory modality. If they have a headache, they like pressure. So they like osters as well. Now, when to think lachesis, loquacious, irritability, jealousy, revengeance, manipulation, lot of games, politics, mind games. These all things reflects of lachesis. They have so much of energy to teach someone a lesson. Like they can go to any extent. Extremely revengeful. Yet, it is indicated in sore throat, especially in tonsillitis. Left-sided, it may go to the right side as well. Empty swallowing, very, very painful. Even they cannot swallow saliva. They are worse by swallowing, and especially they cannot swallow hot fluids. Now, contradictory to arsenic can swallow hot, but lachesis cannot. Now, the pains can radiate into ear. Along with that, they have climacteric hot flushes, and retinal hemorrhage and diabetes. Other remedies which is there, that is Crotalus horridus, bothrops. Headaches, hammering from effects of sun, same as glonine. Hammering from sun, they cannot tolerate sun in any form. Tell me a remedy which always faints from sun if they stay outside for a longer period. And they have weak ankles. And they have weak ankles. So they can faint and they can have weak ankles as well. I said
STR is
weak ankles.
STR is
Natrum carb.
Yes. Who said natrum carb? That is right.
Natrum carb.
So next remedy, luticum, syphilinum, whatever name you call, the most important remedy in our Materia Medica, syphilinum, a nosode, suited to chronic conditions which have poorly responded to the other well-indicated remedy. When you're tired of giving nitric acid, tired of giving Mercsol, Mercsanatus, Mercvivus, think of syphilinum. What happens here is family history of alcoholism. You can find any genetic malnourishment or any genetic malformation or any history of genetic disposition or anything. You can think of syphilinum. The patients who are often thin, weak, poor memory, and many fears, especially of becoming insane. They think that they'll become insane, and they feel compelled to wash their hands like OCD patient all the time. Because of the fear of dirt, they have this fear they should not get infected. Fear of dirt, fear of being infected. Due to that fear, they keep on wash their hands. Same like arsenic. Thermal, hot. Now, let me tell you, if you are struggling with the cases who are typically night aggravation pains, no wonder you are suffering from sciatica, no wonder from any disease who is crying for help only in the night and in the morning is absolutely well. Just give syphilinum 0/1 and see the effect. This typical night aggravation and actually saved many cases just because of help of syphilinum. Because of the typical night aggravation. दिन भर हम ठीक रहते हैं, बस रात भर हम तकलीफ में, उसके बाद सुबह ठीक हो जाता है, सूरज उगता है तो just early morning dawn they are absolutely well. They are better in inland, better in mountains, and worse at night. Syphilinum. And they crave alcohol. They cannot resist themselves from alcohol. And you'll find always there is a history of alcoholism. Suppose I'll tell you example. Down syndrome case, father was alcoholic. Child is suffering from Down syndrome. Give syphilinum to the child. Okay. So skin, ulcers in the mouth, nose, genitalia, recurrent crop of abscesses, and the most important here, the syphilis eruptions, that is copper color. You can see the picture here. The copper colored eruptions. Rheumatic pains which increase and decrease. What? Not sudden, gradually. धीरे धीरे बढ़ेगा, धीरे धीरे कमेगा. That is the appropriate rubric. Increase gradually, decrease gradually. So always when you take the case taking of pain, especially in headache cases also, try to see the character of the pain. तुरंत आता है, तुरंत जाता है. Sudden comes and suddenly goes. Gradually comes, suddenly disappears. Disappearing. तो ये जो modalities है ना, ये सब symptoms लेना बहुत जरूरी है. It is actually an eye opener for you in the cases where you are struggling with this kind of management of these cases. उसको समझें कैसे? ऐसे समझें. आप थोड़ा कैरेक्टर बताओ कैसा होता है. सुई चुभता है, स्टिचिंग पेन है, बबलिंग पेन है, या करंट जैसा पेन है, इलेक्ट्रिक शॉक लाइक पेन. So everything becomes very simple. And try to understand in the patient language only. Don't impose your language on his mouth. ठीक है. इसीलिए हम पूछते हैं कि आप ये बताइए किस जैसा लगता है. Then he'll try to explain you. So syphilinum people, their neuralgic headaches starts at 4 p.m. and get worse until midnight. पूरा रात 12 बजे तक 1 बजे तक पूरा पेन. Now you're struggling with the constipation cases and your even hydrostasis is also failing. Think of syphilinum. So it is a very deep acting remedy. So you think if you give in 200 or 1 ml, please don't repeat often. But if you give LM, you can use at least a few days by LM. Mercury, black oxide of mercury. We all know mercury, profuse salivation, and mercury people have a what? Extremely thirsty. All merc are thirsty. जितने merc हैं, सबको प्यास बहुत लगती है. Remember that. All mercs. They are extremely sweaty. All mercs are profuse perspiration. Even they get yellow staining in their clothes, and the sweat is also like oily, and they are also weak. They have bleeding gums and offensiveness of all the discharges. So it is useful for people who have filthy in both. Mind में भी गंदगी, दिमाग में भी है और शरीर में भी. And mercury people has that impulse to, किसी को भी राह चलते को नाक को पड़े हैं, कैसा है बेटा, this all behavior what they do. So much saliva is produced and always there is a metallic taste in the mouth. That is mercury. And it is thermal is both, as mercury has both aggravation in temperatures, so it is both cold and chilly both. Now worse for sweat, worse for warmth, worse at night. So merc है, syphilitic है, तो night aggravation तो है ही. And thirsty for cold drinks, not just drinks, cold drinks. Tonsillitis, visible exudate on the tonsils, sore throats. It was used heavily in diphtheria, like Merck Sanatus was used, Merck Vivus was used. Now enlarged mumps, diarrhea with green slimy bloody tenesmus, like even Merck or has it. All the ulcers are itching and stinging of all the Mercs. All the Mercs ulcers are itching and stinging, like epi-stinging. Next, common salt, natrum mure. Natrum mure, these patients are thinnest, very, very thin, emaciated, pale skin, spotty complexion with oily hair. And they have depression and they are actually unstable by mind and very, very touchy. ना जाने कौन सी बात लग जाए उनको पता ही नहीं, और एक बार लग जाए तो वो कभी बोले नहीं. ये है ना. They don't like to be ignored. मेरे को इग्नोर कैसे किया, कैसे मेरे को इग्नोर करते जा रहे हो. मैं यहाँ बात कर रही हूँ, आप ध्यान नहीं दे रहे हो. They cannot be ignored. It is actually a towards hot remedy as it has aggravation from cold as well. And Natramur is excellent remedy for coryza. Like in my earlier sessions also I explained the symptoms. Clark has beautifully written it. I have also used it in my clinical practice. Natramur is excellent drug for cold cough in coryzas, especially in coryzas. So if you don't know, please read Clark and read Natramur coryza section. So now modalities, Natramur works 10 a.m., 11 a.m. Works by the sea, works by the sun. Food, they love what? Extra salt. And they are extremely thirsty. Now, how to identify? Thin people, middle lip crack, perspiration on the nose, margin of hair eruptions. He's suffering from psoriasis. Give Natramur. He'll be fine. Drug नहीं change होता. Play with potency. If you're confident that he's the drug, ये Natramur है तो just play with potency and see. Depression, hammering migraines, aftershock, grief, acne, herpes, urticaria, eczema, all the eruptions of Natramur are mainly in the margin of the heads. Psoriasis of the scalp, in the margin of heads. And palpitations, irregular menses, PCOD due to grief. Natramur का क्या है? दुख है, पति सुनता नहीं, ये नहीं, वो नहीं. These all things, griefs and all, and उसके बाद he develops a PCOD. Then that's a Natramur. The very lean, thin constitution. Emaciated necks, Natramur. Thin neck, patli dubli. No matter they eat, they don't gain weight. Like iodums. Next, lycopodium. Lycopodium. They are actually intellectual by mind but weak by body. They have weak intellectual disposition but they lack stamina. करना बहुत कुछ है but कर नहीं पा. They same as Medorinum. What does Medorinum say? Ideas abundant but execute cannot. करना बहुत कुछ है but कर नहीं पा रहा. Same way, lycopodium also is a very sluggish person. He has lot of intellectual knowledge, but he cannot have that much of stamina in the body to work. They may be tall, thin, often have a worried expression on the face. Worried bro. पूछते रहेंगे. Frown, अगर frowning face, frowning rubric में भी देखना आएगा. Ignitia, lyco, ये सब लोग हमेशा frown करते हैं. सामने बैठा है, उसका माथा देखो, सिकंज लगा है. और क्या बोले डॉक्टर साहब? क्या बोले? You can see that expression of anxiousness. So they are sensitive. ज़मीर वाले आदमी, consciousness, ज़मीर होता है उनका. और they don't dislike company and they like to be alone. जब तक मेरे से वो बात नहीं करेगा, मैं बात क्यों करूं? These are the people. They don't want to talk unless they are being approached to. They won't go to the first person and they'll ask, "Hi, my name is this." उनसे दोस्ती करोगे? They are not the people. Lycopodium will wait कि मैं मेरे पास आए बात करे तो मैं बात करूं. So this anticipatory fears and fear of responsibility, fear of undertaking anything new. नया काम तो ले ही नहीं सकता ये आदमी. They cannot do anything new. And even in the stage fright, public speaking, they are scared to hell. Ambithermal. Yet they cannot tolerate stuffy warmth in the room. They are predominantly right-sided. Births 4 to 8 like Chelidonium. Births by tight clothing in abdomen. Births by overeating. They hog like food anything. They are hungry and they are easily satiated. मतलब थोड़ा सा खाना खाते पेट भर जाता है और फिर थोड़ा सा खाते खाते पेट फूल भी जाता है. That is a separate. वो दोनों अलग अलग बातें होगी. Food, they like sweet food. Sweet food like what type of sweet foods? Hot sweets. Gulab jamun, jalebi. These are the typical hot sweets what they want. That is lycopodium. Even उनको खाना तो गरम चाहिए ही चाहिए. गरम पानी चाहिए चाहिए. खाना तो एकदम गरम चाहिए. Tell me a remedy who needs a boiling tea. खौलता हुआ.
Chelidonium.
Yes, Chelidonium. ये differentiation है lycopodium and Chelidonium का. Hot and warm. There is a thin line between warm and hot. We need to understand that very well. I treated a case of frozen shoulder which I posted it. 10 मिनट में उसको 20 मिनट में यहीं पे ठीक हुआ. वो कैसे? We differentiated it very well and we gave Chelidonium. and immediately absolutely he could lift his hands just because of this approach. ऐसा हुआ ना, पता चला उसको पूरा खोलता हुआ चाहिए था. So I choose Telluride. ऐसे. So Lycopodium is a wonder drug, a deep acting, extremely deep acting wonder drug in flatulence, chronic liver disorders, chronic ulcers. In the lingering cases of the COVID, whatever happened, they were the unresolved pneumonia, bolte hain usko, delayed resolution of the stage of the pneumonia. That is where Lycopodium comes to the rescue. In post-influenzal debility, post-influenza weakness, another remedy is sarcolactic acid. Urine may have brick sediment and diaper of infants, which is compared with sarsaparilla. Now, Lycopodium is typical saver or in renal colic. If the person has agonizing pain and tossing in the bed, the first drug to be thought of Lycopodium. And if it fails and there is a lot of nausea and lot of vomiting, think of Osimum canna. Sore throat, right-sided, maybe go to the left. Better by warm drinks and worse by cold. So Lycopodium is the very, very helpful drug in these conditions. Next, the most important drug, that is Medorinum. Medorinum has this, can everyone see this? Swelling in the eyes, in the lower lids. Can you see this? This is typical Medorinums. Or drag like swelling in the lower eyelids. In upper eyelids में किसमें होता है?
Kalika.
Yeah, that's the DD. So, and complete orbital में
phosphorus.
Epis में ज्यादा है. Epis
Phosphorus.
Epis में भी first drug. So this pale waxy skin, suffer from poor memory, certain odd feelings of unreality, as if time passed slowly or as if life were unreal like a dream. They are sensitive people, and this quality may amount to clairvoyance. So they also have clairvoyance. And how they sleep? Typical Medorinum people sleep like this. Suppose a patient is suffering from a UTI and you see if the patient is lying this and they are absolutely ameliorated, the first drug is Medorinum. First drug is Medorinum. Knee elbow position, or knees are drawn up to the elbows and they feel absolutely well. That is Medorinum. So I have seen cases where sleep on abdomen, everything's settled down. That's the first drug is be given Medorinum. Even in sleep on abdomen, I'm not talking about only knees. Knees are drawn up to elbows. Even on sleep on abdomen, he sleeps on abdomen and he feels absolutely better. That's a typical symptoms of Medorinum. No wonder he might be suffering from any disease. Read the old cases, you will find how they were used to treat this kind of cases of any pathology by their physical characteristics and the constitution only. They were not focusing on the disease more. So, better by seashore. Medorinum loves to be at seashore. Worse from daylight to sunset. Subah se leke shaam tak. Better by damp. Better for damp weather. Worse for droughts. Food. They love all tangy, sourly things. Sweet food. Salty food. Oranges. And they have unquenchable thirst for cold water. They love cold water. And even after eating, they have ravenous hunger. Bhook मिटती ही नहीं. Now, arthritis of knuckles, especially in the knuckles, Medorinum. It's not important, especially of the knuckles. In overall, also, Medorinum is a wonder drug for arthritis as well, if indicated, especially gonorrheal rheumatism suppressed. If you find a recurrent UTI history, my first choice of the drug will be always Medorinum. She might be suffering from any disease. That is due to gonorrheal suppression. She might have suffered from this. To take the course ना, journey of disease क्यों लेते हैं केस चेकिंग में? ले journey of disease लेने के बाद ही पता चलेगा क्या क्या हुआ था. देखिए इसको 10 बार, since 10 times she was suffering from UTI only. After that, these complaints involved. Simple, give Medorinum. No other drug would rescue you. This is the power of Medorinum. So nasal catarrh, especially if the chronic catarrh, skin dry, itching, herpes of the scalp, ringworm, and Very, very important symptom. That is burning of hands and feet. These people literally find cold places to put their feet. This is medorinum. They'll say कि डॉक्टर साहब मैं तो ठंडा जगह ढूंढती हूँ कहाँ रखना है उसको पाँव इतना गर्म लगता है क्या बताऊं मैं. And let me tell you very important thing. The burning feet, if you want to differentiate the remedies, the few remedies are these are the only remedies in the Materia Medica who has typical burning in the feet. The first drug is pulsatilla, medorinum, sulfur, and chamomilla. Only these drugs have this burning of souls. Chamomilla, pulsatilla, medorinum, sulfur. So now urine, nocturnal neurosis, bedwetting, frequent urination of night, the diabetes people, suppose bag-like swelling, gonorrhea history or UTI history, lot of sexual abuse, biggest lazy, fatty constitution, doesn't want to do anything, suffering from diabetes, having nocturnal urination, think of medorinum. He has craving for a lot of sour food like pani puri, you can think of medorinum. So I'm just giving examples where to look out. So this is the thing. Even in neuralgia of the head, worse during the day and exposure to light, gynecological cases, even in psychotic sterility, medorinum mein likha hai na? Psychotic sterility, lot of infertility cases, lot of. Even in the fallopian tube blockages, you can think of medorinum. Suppose she had a history of what? UTI.
Recurrent UTI.
That is very important in medorinum. Asthma, even Mongolian childs, Down syndromes, arrested developments. And let me tell you and sum up in one word. Thirsty pulsatilla is medorinum. Medorinum also weeps a lot while complains. So thirsty pulsatilla is medorinum. Next, Nux vomica. Nux vomica is the most important drug of our times because maximum people are highly irritated. All time they can quarrel, they hate contradiction, and they get annoyed very easily. थोड़ी बातों में गुस्सा आ जाना. Hypersensitive to noise, light, smell, and generally, it is indicated to the people who are more of wine tasters. He is often an Epicurean and connoisseur of wine. They are wine tasters who they live only sedentary life, or even to the person who just enjoys his life and do nothing at all. Couch potato, बैठा है बस कुछ नहीं करना है. Chilly, thermal. Now they are they're better by warmth, better in rain, better by being alone, worse in dry, windy weather, and worse after eating. Worse 2 hours after eating, actually. Worse in open air, worse for sun, and they like what? Strong food. Flavor आना चाहिए. Flavor नहीं आया तो कैसे खाएं? These are the people, Nux vomica. They want flavors in their food. So, and they like fat. Now, when can you think of hiatus hernia? For hiatus hernia, also it has very severe action, Nux vomica. Another drug you can think of, that is Robinia. And another drug you can think of sulfuric acid, where in digestive complaints, the patient keeps on complaining कि खाना आ रहा है और ये पूरा जल रहा है और दांत पूरे खट्टे हो जा रहे हैं. That is a typical of sulfuric acid. Sulfuric acid is a drug savior in dyspepsias where they feel. And another drug is natrum phos also. Robinia. Robinia is extremely helpful in hyperchlorhydria cases, in spite of being hiatus hernia also. And sulfuric acid, where they have strong sour irritations, which makes their teeth also, the edges of teeth also are sour. Think of sulfuric acid. No other remedy can rescue. Even give Nux vomica many times, it won't act at all. So, indigestion from overindulgence, diverticulitis, constipations for frequent ineffectual desire to defecate, बार जाना potty but hota nahi saaf. That is a typical of Nux. Hemorrhoids, better by what? Warmth. Onset of common cold, especially if it start with a scratchy throat, the first drug to be thought of, that is Nux vomica. I think I put a question yesterday in Telegram, right? Nobody answered it. Nux vomica is the drug. when there is onset of common cold, especially when there is a scratchy throat. So headache on waking, that is hangover or worse after sun. Acute lumbago attack where the patient has to sit up to turn over in the bed. He cannot turn like that directly to the left and right. He has to get up and then he will turn. That is typical of Nux-vomica pain. Another, it is a word called persistent hiccup or incessant hiccup. That is also Nux-vomica. Another drug is Magfos. रुकता ही नहीं, इतना हिचकी हो रहा है. That is. Next, phosphorus. Phosphorus is typical. You see this long legs, thin man, tall, slender neck. This is the neck, slender neck. This is all of phosphorus. And they have a lot of fears of being alone. They have fear of thunderstorms. They have fear of dark, and they always need someone to be there. They love company. Phosphorus are the people who has a huge gang of friends all time. Whenever he goes here, he makes friends easily. जिससे बात किया रे तो मेरा best friend यार, बस तो दोस्त बन गया. That is phosphorus. Easily he can make friends anywhere in this part of the world. That's a phosphorus. And they are highly touchy people and sensitive, and they will always reciprocate once you give them love. They return their affections. But same way in pulsatilla, they don't return the affection. They'll actually absorb. They'll absorb. They want you to console them till they absorb all your energy. That is pulsatilla. रोते रहेगी पल्साटिला, जब तक उसको चुप नहीं करा, जब तक तुम्हारा सारा एनर्जी नहीं लग जाए उसको चुप कराने, वो चुप होगी ही नहीं. उसके बाद वो चुप हो जाएगी. लेकिन फॉस्फोरस अगर प्यार दो, बदले में वो प्यार देगा. That's return affection. Same like carcinosin. Phosphorus and carcinosin, that's why almost same. So thermal is chilly, and the side affinities are right upper and left lower complaints, that is diagonal, and same as Kali iode. Kali iode also have the diagonal symptoms. So better by eating, and they have night hunger. Better by warmth, except the head and the stomach, because they want cold. Better by rubbing. I did a case of trigeminal neuralgia. He has typical pain and he used to rub like this and he feels better. That is phosphorus. Desire for salt and spices. Thirsty for cold drinks, which may be vomited as soon as they become warm in stomach. They share a relationship of this symptom, especially with bismuth. And when indicated phosphorus, all bright red hemorrhages, epistaxis, and even in menometrorrhagia cases where you cannot stop the bleeding, think of phosphorus. This can actually help and stop the bleeding. Respiratory tract, dry, hard cough, asthma, pneumonia in right lower lobe. Right lower lobe is mainly affected and worse lying on the affected. They cannot sleep on right side. They are better by sleeping on left side. The cough gets better if they sleep on left side, not on the right side, because the right side is being affected. So vomiting can be useful, vomiting of pregnancy. The other drugs are very marked. That is, first drug is Symphoricarpus racemosa. Last, the first drug, and the second drug is Sorina, and still it fails. Then you think of Symphoricarpus racemosa, and also there's a drug called petroleum. Is very marked in vomiting of pregnancy. So headache, migraines, but appetite is not impaired. So even migraines, their appetite is not impaired. Now sepia, the ink of the cuttlefish. Sepia, can you see these brown spots in the face? This is actually, they have like saddle-like appearance across the nose. That is sepia. Repeated abortions, induced abortions. And after that, they got these spots. First drug, sepia. This is suited to depressed, indifferent, worn-out person, generally a woman. And the sepia patient is averse to sympathy. They don't want anyone's sympathy. They're averse to company. They want to be, yet they get to be alone. They don't want to be alone, but they even don't want to be with someone because of their indifference. and she's often dark-haired and the sallow skin. And they are extremely chilly people. Now, CPI is the drug shares same with carcinosin, and they both remedies are complementary because CPI and carcinosin loves enjoying thunderstorm. So always keep a note when you think of loving thunderstorm or watching thunderstorm, CPI and carcinosin both are the only remedies which are very, very marked. Now, carcinosin is also better by dancing and CPI is also better by dancing, better by exercise, worse by tobacco smoke, CPI, and boiled milk diarrhea. Suppose somebody had a boiled milk and after that he has a chronic diarrhea, or he might be suffering from IBS after drinking a boiled milk, or he had gradually developed that IBS. The first drug could be thought of as CPI, but you should know how it started first. है ना, sedentary lifestyle के साथ उसको IBS हुआ, that is a separate thing. हम यहाँ बात करें गरम गरम दूध पीने के बाद, diarrhea especially after boiled milk, desire vinegars, sour foods, and nausea at the thought of food like colchicums. Now, this is a CPI lady, cross legs, sitting in cross legs. And you know what, CPI person, if you see, they even the clothes will get very indifferent. यानी कुछ और ड्रेस पहना, उसके ऊपर कुछ और टाइप का कोट है, कुछ और, उनको फर्क नहीं पड़ता. They don't bother about it. That's called indifference. And how about pulsatilla will do? All drink, all wear what?
Flowery.
All flowery patterns. And what they'll keep on, like when you ask them like this, left, right, nodding by head. This is what pulsatilla differentiate with CPI. And they keep on like this, झूमते रहेंगे बात करते करते, keep on nodding their heads. This is what typical pulsatilla. So CPI, शादी कर ली, झाड़ू तो नहीं मारने के लिए शादी किया मैंने, but करना पड़ेगा. Undertake things opposed to his intentions. They don't want to clean their house, but shit, they want to do. They are forced to do it. They're compelled to do it. They don't want to do it. That's CPI. Mental disturbances, menopausal symptoms like flushes, heat flushes, depression, in PMS symptoms, migraine typically over the left eye, and they have brown patches in the skin, ringworms, herpes, urticaria, falling of hair with an itchy scaly scalp. And what they have a dragging sensation in the pelvis, like same as a lilium tick. Cilicia are the pale face, thin, delicate China doll bolte usko, China doll type person with small sweaty hands and feet. Itna pasina aata chappal phik jata hai unka. The cilicia patients appear gentle and even spineless. झुके हुए लोग. Peculiarly obstinate at times. They are very, very obstinate people. बहुत जिद्दी हैं, obstinate. Cilicia. उनकी अपनी मर्जी होनी चाहिए. And जो वो बोल दिए वो thought हो गया, fixed है तो वो fixed है. You cannot change their minds. These are the Cilicia people. And they get easily panic in the thought of responsibility due to the feeling of inadequacy and dread of failure, fear of failure. So they have a lot of anticipation of exams also because of this. So thermal, chilly. These are the people who wrap themselves better by warmth, worse by the thought of pain and sharp objects. They have fear of needles. They have very strong fear of needles and pins, even injections. Worse for draughts. Better by wrapping up, often tight wrapping up, not just wrapping up, tight se बांधने का पूरा body. ठंडा लग रहा है ना, tight से बांधना. And prefers cold food. Interesting, right? Being a chilly remedy, they need a cold food. Contradictory. And thirsty, poor appetite, dislike meat. Now, when indicated, expulsion of splinters, like kuch bhi foreign body in the body, you give Cilicia, it will expel out. Sphere of examination, boils, disorder of bones, teeth, nails, respiratory tract infections, chest infections that do not clear up, recurrent problems from that originate from pleurisy years back. सालों साल से recurrent cold tendency चलते आ रही, बच्चे में जा नहीं रही है. That this recurrent tendency Cilicia can break if they have the indicated symptoms like sweaty hands, fade, anticipation, and everything. So headache, occipital may travel forwards, often settle over the right eye, better by warmth and being tightly wrapped. सर फट रहा है, पूरा सर एकदम टाइट से बांध दिया. And may follow also mental stress. Now the bashful stool, which is difficult to expel, like ambra grigia. Ambra grigia, white coat hypertension. The bashful stool. Next, sorinum, scabies vesicle. Sorinum, this is useful in chronic cases where a selected remedy fails to relieve a patient, even when it is well indicated. That's where the nosodes come to the rescue. That's why
वापरल्या जात असते काका. परत परत
so it is suited to the people.
समजते. चुकवायला तुम्ही चुकवायला असं नसतात करत. भेटा मला तुम्ही.
It is suited to the people who lack vitality and who appear dirty and smelly even after washing. So no wonder they are washed, they are dirty and smelly. Even after washing, they stink. They are pale and sickly. They have face like pale face, and all discharge are offensive. And they suffer from anxiety as well as the depression. And the head is extremely cold. Even they wear cap in summer. You know, I had a case of IBS who used to come during summers in May and June, and he used to wrap himself in gum. I have sorinum only. That's it. That's a uniqueness. See them. This is worse for changes in weather. Worse for cold. They dread these the drought. Cannot tolerate any for coldness or any coldness in any form. Worse in winter. Always moaning except when eating. खाते वक्त तो कुछ नहीं आवाज निकलेगा. That's a typical sorinum. And sorinum are the most hungry people at the night, like sulfurs. So the skin of the sorinums are crack, rough, itching rash, which suppurates easily. Worse for heat of the bed, dry, scaly scalp with dry hair, acne. Headache is chronic and worse at night, and with headaches with better by eating. मैं खा लेता हूं, मेरा सर दर्द चला जाता है. That is sorinum. First. Now, chronic rhinitis or chronic atrophy rhinitis, hay fever, that is same. He's suffering from many years and you're tired of giving all the remedies. Think of sorinum, yet he's being yet very chilly. Another remedy you can think of, that is thyroidinum. Both thyroidinum, sorinum, both are very, very chilly. Okay. Now, cough every winter cough, every winter sciatica. Which drug? कोई तो बोलो, याद तो होगा. Every winter sciatica, quick.
स्टॅफिसॅग्रिया.
Ignitia.
स्टॅफिसॅग्रिया.
Ignitia is very, very marked in every winter sciatica. Asthma, better by lying down with the spreading the eagles like, apart, arms like spread wide apart like an eagle, like that is sorinum. If the child suffering from asthma, they sleep like this, they feel much better. That's a typical of sorinum. No other drug can help. And chronic catara. Next, pulsatilla, the windflower. Jahan jhukao, wahan jhuk jaye. Remedy suited to sandy head individuals with a tendency to gain weight easily, shy, gentle people, easily move to tears. थोड़ा सा चिल्ला दो आंख में पानी, थोड़ा सा बोल दो आंख में पानी, कुछ भी बोल दो आंख में पानी, हंसने तो आंख में पानी, every motion पानी, आंख में पानी पानी. That's pulsatilla. P for pani, P for pulsatilla. Always remember this. Prone to tearfulness, changeable moods, towards hot. Even they have averse to heat at certain point, but mostly they are aggravated by all hot. Now, typical cases where Rustox is failing, where the motion the pain gets amelioration by motion, think of pulse. Why? Pulse also has the same modalities as Rustox has. Better by fresh air, better by sympathy, worse for stuffy atmosphere, Rich foods and fat disagree, yet they want rich food only. They want pasta, pizza, momo, farnishes food, everything starchy foods, yet they have problem with the stomach, but still they want to eat the same. जिससे problem वही खाना है. The thirstlessness of pulsatilla. But pulse is thirsty. What time? Come on.
Acute phase.
chronic phase में pulses thirsty.
कितना बजे pulse?
Sir, 2 a.m. 2 a.m.
2 a.m.
2 p.m.
2 a.m. 2 p.m.
2 a.m.
2 p.m. 2 p.m.
PM.
2 p.m. 2 p.m.
2 p.m.
It's 2 p.m.
So when indicated, Katara, think thick, bland, yellow and green discharge like Kali sulf. That's why pulsatilla and Kali sulf share relationship. Most of the symptoms are same with the Kali sulf, but respiratory and coryza part is more strongly in Kali sulf. And all the discharges are bland, yellow, thick, green discharge. Never well since puberty. Never well since puberty. Any complaints of the case, any cases, think of pulsatilla. Dysmenorrhea, recurrent styes, even in the recurrent styes, varicose veins, pulsatilla, acid floor, hemamelis, fluoric acid, varicose veins. Skin, eczema, urticaria by cold application mls like pulsatilla. So both are thirstless, both are cold ml. Now you have to see what to give. Difficulty controlling in micturition, enuresis like involuntary urination, also pulsatilla is very marked. I had a case of sciatica, I treated with pulsatilla where involuntary urination along with left-sided sciatica. I gave pulsatilla only. Now, arthritis, shifting rheumatism. Staph, the most suppressed person in life. No, see his face. Cannot do anything about his situation. So helpless. So they are the people who, you know, मन करता है क्या करूं लेकिन खुश क्या करूं सहते रहो घुटते रहो. These are the people. Unjust accusation, they are falsely blamed, falsely implanted. यानी ये सब वही है, बैंक के एम्प्लॉय है, तूने चोरी किया ना, and he will say no, I have not done it, because he was so loyal to the bank for so many years, but now he has been implicated falsely that he is a thief and he has robbed the money in the bank. Now उसके वजह से क्या हुआ, सबके बीच में उसका बेइज्जती हुआ, उसका इज्जत गया. 20 साल से बैंक में काम कर रहा था. He lost his importance. Everybody is disowning him and he has been suspended by bank. ये जो जिल्लत भरी जिंदगी मिली due to suppression and everything, he could not just blame, unjust accusation. This is an example of staff who later on becomes a patient of staphysagria because of this suppression. You know, in office life, the people, देखो दो बातें होती है इसमें. ऑफिस वाले लाइकोपोडियम वाले अलग हैं, लीक एंड लीट वाले है ना. These are the same with the patient with the lycopodium people. How they'll come and they'll praise you. Doctor साहब आप तो महान, आप तो क्या इतना नाम सुना, क्या आप तो, he'll just flatter you like anything. And as soon as he gets out of your cabin, क्या doctor है. That's lycopodium. But how the staff does? Staff will come to you and he'll be in very, very suppressed mood. He is very, very suppressed. Everything is suppressed. His emotions, his angers. He doesn't know how to express. That's the only problem with staff. He doesn't know how to express. That's why he's suffering. He would be knowing how to express and things would be very easy for him. But staff is very upset because he cannot express his feelings outside. So any complaints, any complaints, he might be diabetes, he might be suffering from multiple sclerosis, he might be suffering from any disease. Like I told you example of arachnoid cyst also. So this all, he might be suffering from anything. Staff, if you find there is suppression, lot of teasing in the childhood, he's been suppressing his anger and later on he's just bursting out. Because कभी ना कभी बम फटता है, ऐसा नहीं कि स्टाफ ब्लोन आउट नहीं होगा, बट जब फटेगा तो बहुत गंदा फटेगा. That's a violent reaction. फटता तो है, ऐसा नहीं कि नहीं फटेगा, बट फटता है. Now to compare ill effects of more sexual access is suppression due to suppressed, that is more in staff. Excess of masturbation, excess of sexual thoughts, excessive abuse of masturbation, you can think of staff. These are the people who cannot express themselves. They keep on going masturbate years after years, and then they'll come, they're like very thin and they don't have energy to do anything. That's ill effects of masturbation. Another remedy which has to compared by suppressed anger, that has only 3 remedies, that is colocynth, chamomilla and staphysagria, and at some point cocculus indica. But the main marks is colocynth, chamomilla, and staphylococcus. Any complaints due to suppression of anger, first thing to these three remedies you have to think. Thermal, chili. Now, they love meal staph like Rustox. Rustox also love meal. Worse for cold, worse for caution, worse for touch. Now, the first drug which is always indicated after newly married woman, that is called what? Honeymoon cystitis. The first drug that is staphylococcus. Now, post-operative pain, anything, any post-operative insult in the body, any post-operative after endoscopy or either this, either that, any insult to the organ or the body, and you had damage, think of staphylococcus. So insult is not just mentally, it can be physically as well. So you can consider staph on those cases also. So that is post-operative pain, pain arising from injuries inflicted by knives, headache from vexation, recurrent styes, Meibomian cyst, increased sexual desire, along with impotency and very, very sensitive vulva. Eczema, think of staphylococcus. Sulfur. Sulfur, the rat philosopher. या तो मैं बहुत बड़ा आदमी बन के दिखाऊंगा या तो मैं ऐसी कूड़ा में पड़ जाऊंगा. That is sulfur. Ailment from scorn. He is so much scorned. तू क्या कर लेगा जिंदगी में? तू क्या बड़ा हो पाएगा? नहीं, तू कुछ नहीं कर पाएगा यार लाइफ. So he becomes, to defend this life or his words, he struggles a lot. फिर वो बन जाता है ऐसा. फिर आप दुनिया कुछ ही धर नहीं, बस काम 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 कर. Because he wants to prove others that he is the best. That is the problem where sulfur comes. So sulfur can be neat and tidy as well, as long as very, very filthy, uncleanliness, doesn't bath, selfish, no regards to others, dyspepsia, predisposition to meditation, sciatica standing worse for sulfur. Worse. Sciatica standing worse aggravation, sulfur is a very marked remedy for that. Now, burning of soles of feet, uncover and sleep. So that is a confirmatory for sulfur. When you confirm, when you ask them, do you cover? The same goes with medoranum as well, and also pulsatilla. But medoranum, sulfur are two remedies who cannot tolerate any covering in their feet while sleeping. So these are the mark point for differentiate. Now, sulfur are worse after bath, worse at 11 a.m. What they have a sinking feeling. And worse for standing, like I told you again, sciatica standing worse, that is worst remedy to thought of, that is sulfur. Okay. Always hungry, always hawk food like anything, likes fat, likes sweet, and thirsty. When indicated, eczema, boils, all the skin diseases, suppressed skin diseases, ailment from suppressed eruptions, any past history of each ointment used, think of sulfur. And generally it has been used in LM potency. It acts wonderful in LM potency to avoid the aggravation in centesimal scale. Use LM potency, very good, even in acute or chronic cases, you'll get good results. If you're giving centesimal, then give 30 or 200, 1 dose or 2 dose, or don't use on the regular basis. So diarrhea, early morning diarrhea, L-O-Podo sulfur, we have learned. Now, coming to the hemorrhoids part. Hemorrhoids, prolonged burning after stool. Tell me a remedy which has persistent burning for hours in hemorrhoids or fissures.
Nitric acid.
Ratania. Ratania is the drug. Katara and king of Sora, sulfur. Now, Thuja. Thuja, what we call other name? Tree of life. Made up of glass. He thinks everything is made up of glass, will break easily, fall apart, dreams of falling from high places and waking up. These all things of Thuja. Heavier, suitable for heavier person with a dark complexion and the black hair. A peculiar characteristic is that individuals who need this remedy, which they sweat on uncovered part. So this uncovered part, he'll what? He'll sweat, not on the covered parts. That is a typical of Thuja. And mentally, they suffer from odd fixed ideas, such if their limbs were made of glass, like I told you, fixed ideas. Or if strange person both by the side, and ill effects of vaccination. The first drug, that is Thuja. Second, Entimtar. Third, Cilicia. Thermal, chili. Now, Thuja are worse for the dyspeptics, like dyspepsia of the tea drinkers, we say. Tea tasters or tea drinkers. है ना? And what's for smokers cough?
Ignatia.
Again,
Dysagria.
Staff loves petrol smell and they love tobacco smell. Staff.
Tobacco.
Isha cannot-
Tobacco.
Tobacco and there no more of have you read capsicum? Read capsicum once. So worse for the dyspeptics of the tea drinkers, that is marked for Thuja. So Thuja are the people, they are abusing tea since many years. So that is Thuja. Worse for fat and worse for onions. They cannot tolerate worse for onions, yet they like onions as well. So they love to eat raw onions and yet they have also problems. So both the things are there with Thuja people. And they dislike potato. They cannot like onions. They are worse for cold, damp weather and worse for heat as well. Both the things. Worse in the morning, worse in the night. It is called as chili pulsatilla. Thuja. Yes, chili pulsatilla is Thuja by Dr. Marguerite Blackie. So, skin, large pedunculated warts that bleed easily, polyp, growths, rash on uncovered. So everything is on uncovered parts, not on the covered parts of the body. Okay, or everything will be uncovered parts. So, chronic nasal catra, often green color, styes and tumor of the eyelids, even in the scleritis, asthma, abdomen, flatulence, distension, as if something is living inside. That is a psychotic feeling he has. Constipation, what happens? Stool recedes and partial expels. And tell me the differentiation between a nitric acid stool and Thuja stool. इसका stool तो ठीक है, Thuja का stool recedes after partial, थोड़ा सा निकलेगा वापस अंदर चला जाएगा. What about nitric acid? First stool comes hard, then second stool soft. That is a confirmatory for nitric acid. Never forget.
So calcarea curve also.
Yes, but nitric acid is more marked.
Yeah.
Diarrhea, gurgling, explosive, worse in the morning. Urinary difficulties, cystitis with burning urination and after passing urine. Burning urination during and after passing urine. So Thuja, natrum sulf, medorhinums are very marked for these kind of symptoms of cystitis. All the three psychotic remedies has it. Okay. So the last remedy of the day, tuberculinum bovium, pus from a tubercular abscess or from a tubercular mesenteric gland. Tuberculinum. When well-selected remedies fail in a patient with a family of history of tuberculosis. So suppose you are treating a case which has a family history of asthma, family history of tuberculosis, and the child is suffering from recurrent cold and cough, not at all resolving. Think of tuberculinum. See, you have to see the history.
But if the patient has the history of tuberculosis in the past,
No,
then
you have to see what is the current symptoms on basis of that. See, you have to see the current symptoms, whether he really requires tuberculum or not. It's not important. देखो ऐसा rule नहीं है. Rule है कि कोई rule ही नहीं है. ऐसा कुछ नहीं है कि उसको नहीं. But symptoms does really help, or it is really indicated that tuberculum signs are coming up. That is more important here. Is you can treat with Acarifa indica. You treat with stannum mat, the prolonged exhaustion after tuberculosis. That is called phthisis. Phthisis is the word in Materia Medica used for tuberculosis.
Yes.
So you can receive phthisis or prolonged exhaustion. That is stannum mat is also one of the drugs. So you have to see and correlate with the symptoms what actually the patient is suffering from right now. Even if fast, let me tell you, even the people who has taken this bacillus in injections, their Montux are coming positive. So that does mean that they are TB. They have TB, and the sputum is not. Sputum is negative. So I have seen a lot of cases. What is happening here is their Montux come positive and they have been diagnosed with TB. So that is wrong. You have to figure out whether he has TB or not first.
yes.
So person requires, this is all like tuberculous person who has what? Tall, thin, narrow chested individuals who exhausted easily, like phosphorus persons, narrow chested. Phosphorus pigeon chested. Also pigeon chest criteria person phosphorus. Narrow se yaad hai. So persons requiring this remedy have a constant desire for change and travel. एक जगह तो रहना ही नहीं, change of occupation. Same goes with sanicula. They keep on changing occupation. Now they are cosmopolitan people, like Calcarea Foss. Cosmopolitan मतलब हर जगह का knowledge है, हर जगह घूम सकते हैं, हर जगह form है. They are cosmopolitans. They can stay anywhere, any part of the world. They don't have any problem. And they have a lot of fear of dogs, even the cats, black cats. Thermal, chilly, and they are very sensitive to every change of weather, especially cold, damp of weather. Now, they are worse for changes of weather and they are better by open air. Tuberculinum people and Calcarea Foss, they like smoked food, even carcinosin, 3 drugs, carcinosin, tuberculinum, and Calcarea Foss. These are the people who love smoked foods, barbecue foods. If you ask what type of food they want roasted food. Roasted, aag mein paka hua, smoked, smoky foods. They like that kind of food. And large appetite but remains thin. खाते इतना है but शरीर में लगता नहीं है. Tubercular people, Calcarea Foss people. Now, dislike meats. Worse for standing, worse in evening, and better by open air. And these tuberculinum is the drug where he likes cold milk. They love cold, icy shakes, cold milk. These are the typical desire for tuberculinum. Now, these drugs, it has typical intermittent fevers where they have night sweats which stain the bed with yellow color. Now, let me tell you, tuberculinum is the most jiddikhor, obstinate child of the Materia Medica. No wonder you try your best, that child is never going to listen. So
how to differentiate with tarantula?
Tarantula will more be restless. Tuberculinum तो सुनेगा ही नहीं. You're taking suppose to a doctor, to him, you not even, not even sit, not even listen once also to your command. That is tuberculinum. He'll be in his own all the time. But tarantula will what? Once he enters, he'll enter the cabin, idhar udhar such. Usme ek rubric hai, there's a touch thing compels to in tarantula. They like to, he'll come, suppose an autistic child, of tarantula type. He'll come and keep on like this, he'll do hello, he'll keep on do like this, everywhere he'll touch, this touch things compelled to. That is typical of tarantula's child. And the second drug you can think of, that is serotonin in those kind of children. Excessive energy. Now,
Which medicine, sir?
obstinacy, sorry?
Second medicine कौन बोला?
Serotonin.
Serotonin
जो hormone आता है ना, serotonin. I'll teach in my SAR codes. I'll teach that serotonin also there in my course. Tomorrow we have nosodes and day after tomorrow we have SAR codes. Yes. So they love riding in fast cars and bikes. So tuberculinum, if you ask the child, they love to be, sitting in the bike, in front of the bike, and they want to enjoy that air. They love that fastness, this craze of tuberculinum. This is all my confirmatory symptoms I used to ask. And enlarged tonsils, adenoids, where they breathe and they snore. They have a lot of noise in the breathing, noisy breathing due to adenoids or swelling inside. The only remedy will come to rescue that is tuberculinum. You will see tuberculinum face is more of inverted face like Calcarea Foss, and this will be more up, और ज़्यादा बड़ा रहता है, एकदम चौड़ा हो जाता है frontally. So these are more marked. You can see the tuberculotic face also. That's in constitution. I think I'll teach in nosodes also. Yes, I'll teach in tuberculinum nosodes. कैसे दिखते हैं? That's the most appearance of that. So skin, recurrent respiratory tract infections may be brought to exposure to cold air. Skin eczema with formation of quantities of white scales, ringworm, crops of boils, bowels, constipation with large stools alternating with diarrhea. Large stools alternate with diarrhea. And urgent diarrhea with early morning like halos, podos, and sulfur. Now, menses, periods may be too early or too profuse and painful. There may be in other cases also amenorrhea. There is no periods at all. So this is our Telegram group, which I think many people are there. We are almost 1,000 plus people. We try to interact, learn, help each other. That's a family. That's a small little family which I've built up to help each other, help our own community, help our own fraternity. So everyone can get brilliant results in the practice in the most easiest and simple way. Nothing complexion, nothing, just what you have read in Materia Medica, you have to just practice it in your front of eyes. So this is a group, you can scan the QR code and get enrolled in that group link, and we can discuss 24/7. It is only homeopathy. Eat, sleep, it's only homeopathy. Next, NoSort workshop is being done. It's already one session is up, and tomorrow is the second session. We are treating around almost 42 medicines. Along with that, we have sarcodes on same parallelly Sunday, Monday. Sarcodes, we have around 28 sarcodes also. So thank you. I would request each and everyone, please, on your Insta walls, everywhere, please share as much as you can that how simple things are and how beautiful homeopathy is, and how we can share together, we can learn, aware people that things what we have learned today. That is most important here. The message. क्या knowledge जितना दोगे उतना बढ़ेगा. मैंने आज आपको दिया, आप दूसरे को दोगे. The more you spread, the more it grows. So spread on your Insta walls what you have learned today. What is the message you want to share, everything. I would request all the 100 participants, please share on Instagram or Facebook, anywhere we want to like to share. It's my effort to do something, and I'm really grateful that within a short notice so many people have attended this. And I want to conclude this session. See, talking about 26 remedies is pretty difficult here because it's such a big polyclass remedies, but I have shared the most glimpse which you have got the idea to how to look a different perspective of the remedy. Suppose like pulsatilla, like nodding the head, and there's this pale thing, like chlorotic person, pale face. So these all things are very important, how to identify, how to see the constitutional. Fair fat fabby, mota rahega, re rahega, sluggish rahega, sweating from head. That's it. Calcria ka thyroid hai, usko pair mein ye gallbladder mein stone hai, it doesn't matter at all. So thank you so much. I'll take the question now. Yes.
Sir, I have two questions actually.
Yes.
I need to know the difference between medullarinum burning and cecal burning, cecal course burning.
Cecal core burning is more compared to arsenic and anthracinum. मतलब वो medullarinum से more severe है burning cecal core का.
Okay, just like anthracinum has more burning than arsenic.
Yes, the most terrible burning is like anthracinum. Medullarinum तो कुछ भी नहीं उसके सामने.
So who has more? I mean, anthracinum, then arsenic, then cecal.
Yes, then you can conclude medullarinum. Cecal and anthracinum and cecal and arsenic are both share a same type of burning. Is more of lack of incirculation in cecal core. Indolent.
Okay.
Indolent ulcers which are not healing up, and due to that they have a lot of burning. Then comes cecal core. Yes.
Thanks.
Yes.
सर फैमिली हिस्ट्री में गैस्ट्रिक डिस्टरबेंस है तो उसके लिए क्या करेंगे, क्या सोच सकते हैं?
नहीं, वो तो पहले पता करना पड़ेगा कि ठीक है गैस्ट्रिक डिस्टरबेंस है, ठीक है, उसको अल्सर था, क्या था कि गैस्ट्रिक के कारण उसको वो हो गया, अल्सर बन गया, फिर वो हो गया, तब हम सोच
पूरी फैमिली हिस्ट्री में अगर दिख रहा है गैस्ट्रिक डिस्टरबेंस,
नहीं तो वो तो उनका लाइफस्टाइल डिसऑर्डर होगा, उसको हम लोग ऐसे इतना प्रोमिनेंट नहीं ले सकते. आप करंट सिम्टम्स पे ट्रीट करो, क्योंकि जरूरी नहीं है कि वो फैमिली हिस्ट्री में गैस्ट्रिक है तो फिर हम लोग ऐसी दें. बट अगर इतना रहेगा तो
एनी नोसोर्ट्स
नोसोर्ट्स तो नहीं है,
नोसोर्ट्स है
क्या ऑरिंथोगैलम, अगर इतना ज्यादा डिस्पेप्सिया है तो, अगर है तो ऑरिंथोगैलम एक बार देख लेना.
ओके,
नेक्स्ट.
So one more thing is, while you were teaching phosphorus just right now, you told us that the phosphorus patient is better by lying on left side, but in boric it is written that it is better on lying on right side.
No, both the things are there. Like I explained you, phosphorus jahan pe lying on the affect, suppose if the right side is affected, they cannot lie. Yet there is a sleeping favorite position on the right side.
Okay, favorite position is right side. Yet if
right
they
side
are
remedy hai na phosphorus too.
Okay, that's why they are better by right side. But
Yes.
Actually jahan pain hai wahan
से opposite होते हैं. That is the confusion here. Very good. Yes.
Thank you.
Sir, you speak about the tarantula. So which tarantula we can consider here? Cubensis or Hispanica?
Hispanica. Cubensis में more burning है. Again वो फिर carbuncles में आ गया जो extreme burning है. and it's not resolving at all. So anthracite, tarantula cubensis, carbuncle, severe boils and ulceration and extreme burning. What
Okay, sir.
cubensis का? More of syphilitic destructive nature of cubensis compared to hispanica.
और चाइल्ड में भी वो आपने बोला था तो
Hispanica बोला मैंने,
ओके
not cubensis. So any queries you can ask in group as well. Actually, I have a patients waiting. So
Can you
is there
share
any-
the name of your Telegram group?
let's discuss failures. I'll share the link on the
Okay.
WhatsApp group. You can join
Okay,
that.
sir.
Okay.
Thank you.
Thank you
Thank you,
so
sir.
much.
You are such an amazing teacher. Thank you so much.
No, thank you. I'm trying just best. I'm still a student. I'm trying to learn every day and just sharing with you guys. That's it. My job is to help homeopathy and motivate to the bestest level what we can bring up to, without any confusion and without any mixing things. It's very simple. What you have read, just you see in front of your eyes. That's it. That's the way you can read each and every drug, because we say now patients are the best teachers of Materia Medica. That is the fact here. And even in the movies, like you see movies, lot of movies you see, you'll find the remedies, different personality and constitutional. You'll see by movies only. Movies are the also best teachers. You can see the remedies. Like if you want to see LNSI, you want to see Lycopodium, Hrithik Roshan ko rote hue dekh lena. He'll like continue. Yes,
Alia Bhatt also. Alia Bhatt.
So this is a perfect teacher, you can say.
अभी आप जैसे पढ़ा रहे थे ना सर, तो मैंने कैसे नोट डाउन किया है, नोट कैसे बनाया है कि ये कैरेक्टर मैंने देखा है, ये मेडिसिन, ये कैरेक्टर देखा है, ये मेडिसिन, जैसे आप सिम्टम्स बता रहे थे वैसे मैंने वो पर्सन को नोट करते गई कि हाँ मैंने अपनी लाइफ में ये देखा, ये मेडिसिन, तो बेटर होता है याद करने में, माइंड में रखने में।
इजी है, सब इजी है। एंड इवन आप लोग को रिक्वेस्ट रहेगा, कैथरीन कोल्टर आप जरूर पढ़िए, पोर्ट्रेट ऑफ होम्योपैथिक मेटेरिया मेडिका। मैं शेयर कर दूंगा, लेकिन वो टेलीग्राम में ऑलरेडी शेयर्ड है। आप लोग टेलीग्राम ग्रुप में आ जाएंगे तो उसमें ऑलरेडी है लिंक। आप कैथरीन कोल्टर पढ़िए, आपको बहुत मजा आएगा।
Sir, the session was amazing. We need more sessions like this.
Thank you. I'll definitely come up with more sessions soon. बहुत ज्यादा difficult रहता है, but ठीक है, I'll definitely come. And
Sir, I always used to wait for your sessions. I can't tell you.
Thank you so much. I'm humbled actually. That's my all efforts have been answered, and that's what I want. And please share your feedbacks everywhere. That is the most thing I want.
Definitely, sir. Definitely.
Sure, sir. Always. Thank you so much, sir.
आपके सेशन में सर डिफिकल्ट चीजें भी ना इजी लैंग्वेज में सीखने मिलती हैं, ये सबसे एक
Exactly,
अच्छी
the
learning
session
इस
was
तरह में।
मतलब हर चीज ऐसे स्मूथ लग रही थी, हर रेमेडी की, मतलब काफी सारे
सब
कंसेप्ट जो
स्मूथ ही है,
थे वो क्लियर हो
सबको
गए।
स्मूथ ही बना दिया गया है।
Sir, you are amazing.
सब स्मूथ है।
Thank you so much,
स्मूदी
sir.
बना के पिला रहे तो नहीं पिलेगा ना, किसी
Thank you
किसी को
so
स्मूदी
much.
पचता नहीं है। सब सिंपल पढ़ो, तब सिंपल दिखेगा। थैंक यू
Thank you, sir.
Thank you, sir.
थैंक यू
sir for great session.
Thank you, sir.
थैंक यू
Sir, I am saying thank you so much.